This is an example of somatosomatic reflex. We talk about it as being a stretch reflex. Basically, this is the dorsal horn. This is the ventral horn. So this would be like the person laying on their back. Okay? Information comes in, goes up, goes through the interneurons, and then if it's appropriately of the right impulse strength, it'll manifest down through the motor nerve or the alpha motor neuron to cause muscular contraction. Positive stretch reflex is where we have a rapid lengthening causing a rapid involuntary shortening or contraction. That's what we most typically see in a knee-jerk reflex or a bicipital reflex, something like that. It's called a positive stretch reflex. A negative stretch reflex, which is described in Guyton's medical physiology text, if you're interested in that kind of thing. Negative stretch reflex is where rapid shortening causes a rapid normalization of muscle belly length. That's kind of the key ingredient of the what? What technique? Style. By Shiowitz. Facilitated positional release. It's called an activating force, right? You normalize, you get a rapid what? A rapid shortening, right? You rapidly shorten the person's area, whether it be a shoulder or whatever. Then if it works appropriately, you have it set up appropriately, what do you get? You get a rapid normalization of the tension throughout the muscle belly. That's called a negative stretch reflex. That's associated with facilitated position. Another example of somatosomatic reflexes that we utilize clinically are basically this one here, which is a pain nociceptive withdrawal or flexor reflex. It uses the concepts of reciprocal inhibition and the idea that there's a cross-extensor relationship. The example here is what? If we voluntarily flex the bicep or contract the bicep, therefore flexing the elbow joint, what's happening reciprocally to the tricep, which is the extensor or the agonist-antagonist relationship? It's going to reflexively short or lengthen, and it has to voluntarily what? Relax, or involuntarily relax. So we can utilize that in what kind of a treatment approach? Muscle energy approaches can make use of that, correct? Okay? What's a cross-extensor reflex? Well, if you think about it, if you're walking along and something jumps out and barks at you and scares you, this is kind of a normal position that you might assume, or if you touch something, you pull away, you recoil. Basically, if you contract the extensor, the bicep on this side does what? Relaxes. The bicep on this side contracts. The extensor on this side does what? Relaxes. So basically, cross-extensor means if the right side is contracting, the left side is relaxing. That's a cross-extensor reflex. And you can utilize this information if you have somebody that has something that's really a problem on one side and you just can't deal with it, you can't touch it. You can treat the opposite side utilizing the cross-extensor reflex and therefore passively get lengthening or stretching of a muscle by simply contracting and relaxing on the opposite side of the body. Use this a lot in upper body, use it a lot in what? In the pelvis or the hip, right? Because if I contract, if I have the person, I'm doing muscle energy and stuff, and I want them to contract the right extensor, the right gluteal, that will allow us to do what? Get greater range of motion of the left, won't it? Because as this is contracting through the cross-extensor reflex, the opposite side is going to relax.